Okay, so today I'm going to bring you through the Burton Group case study based on our recommendations and findings. Myself, Bryan and Aishling will bring you through the presentation in which we have conducted on the Burton Group case study. So firstly, I'm just going to contrast the Burton operating model with leaders within this industry. So firstly, in the Burton Group, there is a current total average wait time for a patient is 317 minutes. In comparison to other leaders in the industry, their total average wait time within an ER is 120 minutes. There's growing frustration and scepticism surrounding the systems among staff within the Burton Group case study. This can be seen within the blood draw process when there is inventory mismatches. Within the leaders in this industry, the employees are empowered and technically competent amongst the systems within the hospital. In the Burton Group, there is inaccurate inventory management resulting in a decrease of staff productivity. Within the leaders in this industry, they're seamlessly integrated on-demand supply chain flows.
Okay, so as Ciara alluded to earlier, I'm just going to go through the current operational shortcomings of the Burton Group. As we've noticed from our analysis, there are universal failures across the system utilisation. These are as follows: the staff's continued approach to manual documentation of patient information illustrates the resistance to continuous improvement. This is more of a cultural aspect of the staff themselves along with management. There seems to be a distinct lack or discouragement amongst the staff to take up new information systems and whatnot. They're kind of stuck in the past in that sense. Also on top of this, there is an inappropriate use of a push-demand system for blood draw, and their operation inefficiencies result in the primary non-value-adding metrics of triage, which is currently at 64 minutes, doctor access, which is currently at 65 minutes, and finally the discharge, which is at 79 minutes. Now, in terms of the blood draw and the discharge, which we focus on in particular as the main bottlenecks in the system, the push-demand system was very inefficient amongst blood draw. It is not really necessary. Each patient at the moment undergoes a blood test, regardless of whether it's actually needed or not, from the physician. On top of this, then there is also inventory issues. Nurses have stated that there are often inventory issues with going down with gloves and etc. This is another issue, possibly to do with the vendor at the moment, which is Medline. And of course, with any lean system, there's unnecessary movement involved, which is not an aspect of a lean operating system. The unnecessary movement can be seen through many different processes, such as using the wheelchair to move patients around even though they're fully capable of walking, and nurses' unnecessary movement passing on handwritten documentation. In terms of discharge, it's situational dependent. In terms of the batching, it's not really necessary. Some patients who are perfectly fine and willing to go home have to wait until other patients are discharged. This is unnecessary in our opinion. Documentation also, this can lead to potential for human error amongst handwritten things, and this is particularly important in a hospital situation. And finally, a communication barrier between physicians, nurses and patients amongst all the three. The communication barrier is very prevalent. So I'm just going to pass you on to the recommendations we have for these problems, which Aishling will cover now.
On a longer term horizon, we are recommending that the organisation conduct a feasibility cost-benefit analysis on implementing an EHR system. So this would be contrasted with an EMR system, so it's basically the update of it. So what the EHR system would allow the organisation is to follow the dynamic movements of patients around the hospital and from different hospitals. This would cut down on the necessary documentation time spent confirming information that is really standard practice now in the organisation, and also it will be allowed to implement a more personalised system for every patient that enters the hospital.